Success on the ATI maternal newborn exam depends on a specific prioritization mindset. You have to move beyond simple clinical facts. The exam is built around three core pillars of nursing practice: assess, stabilize, and educate. This matrix provides a structured way to evaluate each scenario, filtering out secondary symptoms to identify the primary nursing priority. The four-question framework serves as your primary filter. Before choosing an answer, ask, is this expected? Is mom stable? Is baby stable? And what will harm them first? The first filter separates expected pregnancy discomforts, like mild nausea or fatigue, from unexpected red flags, like heavy bleeding or severe abdominal pain. Unexpected findings take priority. Next, check maternal and fetal stability. Look strictly at the ABCs: airway, breathing, and circulation, by checking vital sign indicators for drops in blood pressure or spikes in heart rate. The absolute highest priority threat tested on this exam is maternal hemorrhage. Heavy bleeding paired with tachycardia and hypotension means the patient is unstable. Using this hierarchy places physiological stability at the top of the decision-making process. This ensures that threats to circulation are not overlooked for less critical data. Many questions focus on the best or first nursing action, often presenting multiple clinically plausible options. The priority guide dictates a specific order. Assessment, patient education, and advocacy must happen before moving to invasive interventions. This applies directly to behavioral and psychosocial questions. If you suspect interpersonal violence, the priority is interviewing the patient alone. If navigating cultural practices, assess the family's beliefs before making assumptions. Maintaining an investigative, non-judgmental stance keeps you from selecting punitive or assumptive distractors. Beyond prioritization, there are high-density diagnostic data points you must memorize to save time. This graphic highlights the absolute contraindications for estrogen-based birth control, smokers over age 35, and patients with a history of deep vein thrombosis or stroke. You also need rapid diagnostic correlations. An elevated alpha-fetoprotein indicates a neural tube defect, while a decreased level points to Down syndrome, and a luteinizing hormone surge triggers ovulation. Instantly recognizing these direct clinical correlations clears your mental bandwidth, allowing you to focus on the more complex, scenario-based prioritization questions. When you are stuck on a difficult question, rely on your ultimate fallback mechanism. Look for the ABCs to identify immediate physical threats like hemorrhage. Once life safety is secured, the correct response aligns with the nursing goal of patient education and safe advocacy.